Drummond family?
Here I am.
Hello, Mrs. Drummond.
Hi.
I was a doctor in with your husband.
Yes.
Surgery went well. He's doing good. He's in the recovery room right now.
Mm-hmm.
Should be about 30 minutes before you can see him, okay?
Thank you, doctor.
You're very welcome.
Thank you, sir. Oh, wow, it's been about 2 hours since they told me that. Let me call back here and see what's going on.
Thank you, David speaking.
Hi, my name is Mrs. Drummond. I'm calling to check on my husband.
What's his name again?
Drummond.
Do you have his access code?
No, I don't have an access code. They didn't give me one.
Where are you at?
I'm in the lounge.
In the
In the
lounge?
family lounge.
Okay, I'll be right over there, okay?
Thank you.
Let me see, who's this person? Okay. Hey, I'll be right over. Can you watch my patients? I gotta go talk to this family member. Drummond family?
Here I am.
Hi, I'm David. I'm taking care of your husband. He is your husband. Do you have an access code or something?
I told you over the phone that they didn't give me an access code.
What's his last 4 digits for social security number?
1234.
Okay, well, your husband's doing just fine. He's resting right now.
But when can I see him?
Well, right now the house is full. We don't have any beds available. We're waiting on bed flow. So
That's not my problem. I just want to see my husband.
I understand. I can't really have you come back there because of privacy reasons for
I
other
understand
patients in
that.
there too.
But I want to
So-
see my husband.
I'm trying to help you out, ma'am. Okay?
No, you're not. You're being rude. And don't talk to me like that.
Just calm down, okay? I'm just trying to help with
Once
the situation.
again, don't tell me to calm down. I just want to see my husband. That's all.
Well, I can't do that right now.
You know
That's not
what?
an
Don't
option.
even worry about it.
Okay.
I'm going to call somebody. I'm going to call the supervisor and
You
let them
know-
know what's going on.
Yeah, fine. You go ahead.
I will.
I can't do anything right now with him because there's a bed of silence.
That's still not my problem, but I'm going to call
It's
the
not my
supervisor.
fault that they can't move the patients either. Okay?
That's fine. Thank you.
Okay, whatever.
Thank you for calling Nursing Administration. How can I help you?
Yes, my name is Helen Drummond, and I was calling to complain about the nurse who's taking care of my husband. They told me to stay here for half an hour, the doctor did, and it's been over 2 hours and I haven't seen my husband yet, and I'm worried. I don't know what's going on.
Okay. All right. Well, I can understand your concern. Let me check into the situation. I'm going to call over to PACU and find out who's taking care of your husband, and we'll get some information to you shortly, okay?
Thank you.
Thank you for your patience.
All right.
Bye. Hi, yes. Can I speak to the nurse who's taking care of family for Drummond? Okay, well, can you have them to go ahead and come over to Nursing Administration? I need to speak with them, please. Thank you. Bye-bye. Hi.
Hey, it's David.
Come on in.
Hey, I was told that you wanted to talk to me.
Yes, real quick if we can. I know you're busy, but
Yeah, I'm a little
have a
busy.
seat. Let's have
Sure.
a quick
I'm a
conversation.
little busy, but okay, what's up?
I had a family member call in and complain. She's been waiting for her husband to come out of surgery. She says she's been there for at least a couple of hours already, and the doctor told her it was going to be half an
Is
hour.
that Mrs. Drummond?
Yes.
I went out and talked to her already, and the doctor's talked to her, and it has not been 2 hours.
Okay.
It maybe an hour, but no way it's been 2 hours. And I tried to explain to her that, you know, we don't have any beds available, and there's no time that we know when we can.
Okay. Well, you know, maybe it wasn't quite 2 hours, but we kind of have to look at her perspective, you know, from her perspective. Put yourself in her shoes. She's got a family member, her husband, who just had surgery. And, you know, sometimes 1 minute can seem like it's way too long. She's been sitting out there for a while, I guess, you know. Best way to handle that is just to try to give her quick little updates, you know, even if you can make a short time where she can come back and see her husband and just lay eyes on him and make sure that he's okay. You know, and if not, then of course, you know, just continue to go out there and update her.
It's just been busy in the back. I guess you're right. I probably could have had someone else watch my patients while I went out and gave her a quick update. Every 30 minutes or so is when we're supposed to, but sometimes time just flies and I don't realize it. And maybe I should have been a little more sensitive when I went and talked to her about that.
Yeah, I think so. You know, the thing is, you know, it's very stressful sitting out there and waiting for your loved one to get finished with the surgery and everything. And, you know, no one wants to be here in the hospital, but we want to also be concerned about, you know, patient and family satisfaction as well.
Yeah.
You know, so we want to make sure to keep her informed as much as possible, you know, and as well as the husband. I'm sure that he probably wonders how his wife is doing out there as well. But anyways, we need to turn this around, okay? So let's go out there and talk to her and see if we can't, you know, turn it around and let her know that we really are concerned about how she feels and we don't want her to be
I understand.
any more stressed than she already is.
I understand.
All right, well, let's go talk to her.
Okay, I'll follow you.
Okay. Hi there. Ms. Drummond.
Yes.
Okay, hi, my name is Janice, I'm from nursing admin. I spoke to you on the phone earlier?
Yes.
Okay, I just wanted to come and talk to you and let you know, just reassure you that your husband is doing okay, all right? We could have done a little bit better job of keeping you informed, and that's why I'm here, because I want to apologize to you.
Okay.
I understand it's a very stressful time right now, and we want to keep you updated as much as possible. Is there anything that we can do to, you know, I mean, we really appreciate you being patient out here, but I want the nurse who's taking care of him to come in here and talk to you and
Okay.
give you a good update and everything.
Yes.
And we're going to continue to do that until we can get his bed assigned and get him upstairs to a room, okay?
Okay, thank you.
All right. I do apologize once again for you having to go through this, and we're going to make sure that things go well from here on out, okay?
I appreciate it.
All right.
Thank you, ma'am.
Thank you.
Hey, Mrs. Drummond.
Yes.
Hi, this is David again. I'm sorry we got off on the wrong foot earlier. I was just real busy in the back and I should have been a little more sensitive. So again, I want to apologize about that.
And also, David, I want to apologize to you for my behavior. I was pretty rude and stuff, and it's only because I'm really concerned about my husband. So please forgive me.
And I understand how, you know, stressful it can be with your husband in there.
Yes.
And I really wasn't putting myself in your shoes and I should have done that.
I understand.
So, like I said, it is something that we can't move your patient, your husband yet because of room assignments.
Mhm.
However, what I can do is I can move him over to another area because he's nice and stable and he's just resting comfortably.
Mhm.
I'll move him over to one side so that then you can come in and sit with him and still be in that privacy so it doesn't affect the other patients.
I would
as well.
appreciate that so much.
Yeah, that's too easy of a fix.
Okay.
Again, I'm sorry about that. Give me a few minutes so I can get it moved over and then I'll come back and get you, okay?
All right, thank you so much.
Okay,
David.
thank you.
All right.